Welcome to this, I would say, the most important session of this meeting. Right? And we try to keep you awake, because postprandial hyperglycemia, the lunch thing is not anybody's friend, right? All right. So my name is Faiz Bojani. Disclaimer, I'm a former chief medical officer for Shell, just retired. So they have still put my old title, but that's okay. I think you can forgive me for that. They also put the logo here on my badge. I'm a physician executive, as I said. Let me start by giving a little context to the two key presenters on my left, Dr. Ray Fabius and Steve Cyboran. The drivers of healthcare and healthcare costs, right, are multifaceted and multidimensional. And I think all of you know that. And therefore, the solutions are equally complex and multi-layered. Now, I would like to have a sort of another disclaimer here that we should never, and personally from my experience, I never went for reduction of healthcare cost as my primary goal. Okay? I always went for improvement in the health, culture, and well-being of our populations that we served, and as a result of doing a good job with that, you expect the outcome to be a reduction in healthcare cost. Yeah? That was a fundamental difference between my approach for a few years and my benefit counterparts who always wanted to reduce the unit cost of care. I think you all understand the unit cost of care. I was always of the opinion that we need to reduce the units of care rather than the unit cost, because when you reduce the units of care, the unit cost will automatically come down. And you will get tremendous sundry benefits from the health and well-being of your population, not just in healthcare costs, but in productivity costs, which are multi-times more than healthcare costs for any large organization. Okay, so the topic today is organizational culture. So just by a raise of hand, how many of you know or know very well what does organizational culture really mean? Just a few hands up. Okay, all right. Well, then let me give you a 2-3 minute background of that, because I think that's an important context to start with. Now, organizational culture is like the personality, the character, the feel of an organization. Yeah? So where does it come from? Yeah? So organizational culture have a few key characteristics that one should think of or know of before we think of culture. And then I'll relate it to why it is important to health, healthcare, and cost. Yeah? So the culture is typically grounded in the commitment of the organization towards its shared purpose, goals, vision, mindsets, norms, behaviors, all of those things. Yeah? It is grounded in those. It is exemplified and amplified by the words and the deeds, so the actions of their leaders. Yeah? So you hear that all the time, right? It is visible in all relationships, be it with your peers at work, be it with your customers, be it with any other stakeholder. Yeah? It is actuated, right, in the architecture of the organization's policies, procedures, processes, whatever else you call them, right? So you can see them there. Yeah? It is evident in the stories and rituals and aspirations of the organization, yeah, and its people. And it can or it must be felt by a new member or a visitor. If you were going to go visit Shell, you should be able to tell by the end of your 2-hour visit, oh, what are these things, right? You should be able to get a pretty decent gut feel for it. You may not know what this organization does, but you'll get a feel for the culture, right? Now, without going into details, because there's a lot about the culture, I want to say a few things as I've spent a lot of time at Shell in the leadership role. The culture can be intrinsic, internal, or driven by extrinsic factors, right? In Shell, for example, the top management, the C-suite, openly communicated to its staff the importance of adopting an ethical attitude. Now you say, this is an energy company. Why are they talking about ethical attitudes all the time, right? While responding to market drivers and needs. Yeah? So what does that mean? If there is an opportunity, a market opportunity, we would not go, or Shell would not go, in merely for the profits. Because you can make profits by all sorts of ways, right? Ethical and unethical. So the top management talked about ethics and ethical attitude all the time. So when we would go in, you would make profit, but only ethically. Let me then talk about what were the core values, because all organizations have some core values. And for Shell, it was the honesty, integrity, and respect for people. Now, why is that important? Obviously, it creates trust, openness, relationships, teamwork, professionalism, all of the above, right? And a pride that people have working for those organizations. Now, you may have friends and acquaintances when you talk to them when you talk to them, how's your work? And you'll hear some story. And then there'll be a few friends and acquaintances where they say, oh, I really enjoy my work. The organization is benevolent, the organization is fantastic, the people around me. So, that's the piece that is very important to see in any culture. Another example I would give of this is, in many parts of the world, there is a culture of what is known as facilitation payments. I would call them bribes, right? Facilitation payment is nothing but a bribe in a nicer way of putting it, right? Now, if you work in an organization like where we have business in 80 countries and projects all across the world, there is a norm in many countries where you have to grease the palm or facilitation payment. Otherwise, your project may be delayed, your inspections may be flawed, you may not get your equipment on time, you may not get your visa, etc. for your people, right? For decades, Shell has said, we will not offer any facilitation payments for any reason, even if our business is delayed. Yeah? That's a big thing because your competitors can get an advantage by doing that. But that's a sort of an ethical attitude that one needs to know. Now, the important thing is, why is all of this important? Yeah? Because you want to build on the core values of the organization, on the culture of the organization, to then build your health and well-being programs. Yeah? So it is critical for health leaders in any organization to leverage the existing culture, right? And use it as a hook to gain entry, yeah? And a space on the executive table or the C-suite table or any other table that you need to create a space on. This can be, in terms for health, could be access, issues related to access, issues related to promotion, and issues related to protection of health, right? So it doesn't matter. But any health-related value proposition that you have, or a program or a project that you want to bring to the organization, must be justified and founded. This is how I used to do it, and founded in alignment with the organizational culture. Because if we don't do this, you do not gain the support of the leadership for the program. And if for some ungodly reason you did get the support because you knew the CFO or the CEO, it will not be adopted, will not get traction in the employees. Because it feels non-authentic and foreign to them, right? It's an alien concept. So those are the basic things one needs to understand before you embark on developing any program around that. So for this session, I have the pleasure of introducing two terrific speakers, as I said, who have a deep understanding, familiarity, and knowledge in both the corporate cultures or organizational cultures and health and well-being programs. They will share some unique perspectives, and I truly say unique as I mean it, regarding health, healthcare, and healthcare costs. Remember, I am using the word cost at the end, although that's the title of the session, right? And I gave you the reason in my preamble. Because healthy culture will bring reduction of everything, including cost, right? So just a line about Steve Cyboran, our first speaker. He's an actuary and a chief behavioral health officer for Humaculture, which was founded to cultivate thriving people and thriving organizations. Yeah, he's an actuary, so he put together a quantifying model of the impact of healthy enterprise in reducing health issues and healthcare costs. And then we have Dr. Ray Fabius, a physician executive, a good friend of mine, who has, I don't know, run so many organizations, founded so many organizations, but chiefly I would say he was the chief health and medical officer for General Electric. Yeah, most of you know that. He was the chief strategist for Walgreens. Yeah, and he is a prolific speaker and a prolific writer. Many articles, probably about half a dozen books. He just told me he has one almost ready to go. And one book that I particularly like around population health is called Population Health, Creating Cultures of Wellness, yeah, which is very pertinent to our conversation today. With that, I'm going to ask Steve to kick off. Thank you.
Thank you, Fayez. So I'm going to be talking about my journey and how I came to this concept of humaculture, and then Ray is going to talk about his journey and his approach to creating cultures of health and well-being. So our objectives today is to help you understand how important it is to be intentional about the cultures that you're trying to create. Apply it every day with operational rigor, and then you will see success, not only in your culture, but in everything you do. If you really are intentional about your culture, you're going to see success in all of your initiatives, and everything you do will be much more successful. I want to start with a little story. I started my career at one of the major actuarial firms, and in 1999, I transitioned to a smaller, but one of the largest private actuarial firms. And I showed up my first day. There was a stack of papers about 2 feet high, very neatly stacked, type A personality, new boss. And he says, sorry, I can't be here for your first day. We just got a new client. Our first meeting with them is tomorrow morning at 8:30. Read this material. I'll be in at 8 o'clock so we can prepare. And so this happened to be for an airline that lost a couple of planes in 9/11. And so prior to 9/11, one aspect of this assignment was a loss of license plan for their pilots, where the definition of disability is basically a long-term disability where you lose if you lose your license due to a health issue, you're eligible for this benefit. And so prior to 9/11, the decade before, every year 16 to 20 pilots would go out on loss of license. After 9/11, it shot up to about 100 for the next 2 years. And the client was like, what happened? It says, these people just don't want to fly. Can you please find somebody that could recertify the medical on these pilots, and we'll just get them off the plan? And so I found somebody that specialized in these types of plans, and they went through every claim. They were using surveillance on them and everything to verify that they actually had the medical conditions that they claimed they did. And they went through about 200 claims, and every claim was considered legitimate except 2. And so then the client said, well, what happened? And I had the unique opportunity of digging into the data, talking to the pilots, doing literature review, and my final conclusion was their jobs fundamentally changed. They went from being the cowboys in the sky, they loved their job, had a lot of autonomy, they were paid well, worked reasonable hours. And then after 9/11, they had to let several thousand pilots go, and the outlook for these mainline carriers was very much in question, so that their job security was gone. They then had to negotiate significant pay and benefit reductions and work longer hours, so the balance of what they were getting for their effort and commitment was out of whack. After that, they had highly publicized executive bonuses. So needless to say, that climate of trust and respect was shattered. So I then realized that the organization itself had a huge impact on the health and well-being of the people. So we then my colleagues and I, we developed a maturity model. We actually had 6 dimensions or 6 characteristics that we developed, but we did a study focusing on these because we thought they could all be handled by the benefits or HR leader and without too much difficulty. And we asked them a series of questions, probably between 1 and 3 questions to each of the boxes about how effective they are at doing these things. Then we also gathered some independent outcome metrics to test it. And so our 3 stages, the first is very reactive. You're waiting for health or well-being or absence or some kind of breakdown in the person to occur, and then you're dealing with it after it's occurred. The second is more proactive in that you're understanding and identifying those things that are those risks or the conditions that are going to lead to the breakdown, and you're trying to manage or mitigate that risk. And then the third is even beyond those risks. What are you doing to optimize behavior and health? And then we have these different characteristics, and by raise of hand, how many of you would say your primary focus when you're trying to manage your health plan is on that top left where you're providing high quality and cost-effective treatment? Okay, so a few of you. Interestingly, we looked at each of these cells to the overall, to the outcomes that we had 5 different outcomes that we were looking at. Every cell on here was correlated with at least one, generally more in this third column. These were generally 3 to 5 correlated. These were generally 2 to 3. These were generally 1 to 2. Except there's one cell on here that wasn't correlated with any, and it's that top one, health plans focus on treatment. So what are you doing to provide high quality and cost-effective care? And I think this gets to Dr. Fabius's supposition that once somebody's in the health system, they're going to be expensive, even if you manage it really well. And that was my final conclusion, is that you can only manage cost so well. So what we did is we started to think about, well, how do you really shift their thinking? And so we really need to get away from the traditional fatalistic approach to things in thinking about how do we deal with health costs or absence or discipline issues after they've occurred, and how do we be more proactive, and really how do we create a sense of engagement and motivation and performance, the health and fitness of our people, as opposed to just dealing with costs after they've occurred. We got to move away from driving our decisions based on what the competition is doing. How many of you have ever heard of somebody achieving excellence by striving to be average? Anyone? Okay. But that's what most organizations do. They look at what everyone else is doing and say, okay, well then we must do what everyone else does. That doesn't create any competitive advantage for you. So we really need to think about how are we going to create something that's going to give us a competitive advantage. And your thinking changes. We got to get away from just looking at costs, and how are we going to get to outcomes and workforce outcomes, not just health outcomes, but workforce outcomes, health being one of them, and not health costs, but true health. Are they motivated, productive? Are they ready to work? So when I went out on my own in 2016, I met somebody that started his business about the same time, and somebody introduced us together, and he is an organic gardener, and he maintains a 5,000 square foot garden all organically, no artificial pesticides, herbicides, fertilizers, fungicides, anything. He's able to do it all organically. And when he heard me tell that story about the pilots over and over, probably dozens, maybe 100 times, he said, everything you say sounds a lot like organic gardening. If we think about the organization as soil and the people as plants and the products and services they're producing as the fruit or the harvest, it's a pretty good analogy. Then we went through about a year of kicking this idea around, running through a lot of my case studies, some of the research that I did, the various research studies I did. And it actually is a really good analogy for it. So we came up with these 7 dimensions of humaculture, and there's perfect analogies almost in horticulture. And everything that I've done could be explained from horticulture terms, plus things that I didn't have good research on, we could find analogies or research in horticulture that could support those ideas. So, and every one of these are intricately related to each other. So anything that we do, whether it's redesigning a vision plan or thinking about the operations of a new division or a company, we've got to think about all of these aspects. So the real assets is your space and fertility. You've got only so many assets that you can do, and you've got to invest those properly. The rewards, which is our nutrient distribution, that's our pay, benefits, the value to customers. We got to think about how we're going to take those assets and invest them in our organization to get the best outcomes. And we need to think about all of these other aspects. When you're investing in one place, you're maybe not investing somewhere else, and there's always opportunity costs that we need to think about. So we developed then a process for how do you create such an organization. So much of my consulting career was let's think about the problems and let's try to address the problem. And one time I was working with an internationally renowned health system, university health system, and they came to me after I came up with this concept. I was speaking at a national conference on this healthy campus, and they came to me and said, we want you to help us take our initiatives to the next level. And they were one of the most advanced at the time. And they said, and so our national practice leader put something together, and it was very much, let's assess where you are, and then we'll figure out where you go. And I said, that's not what they're going to want. But he said, no, this is what we're going to do, because he was a national practice leader, so he got to say. And I said, so they came back and said, no, I don't want to do that. I said, I want to start with a vision. I don't want to get anchored in what we're doing today. And so what we wound up doing is when we got together with their academic leaders, their health leaders, their administrators, and when we came up, they said, we want to transform our city from the city of medicine into the city of health. And then the investments they made were so different than what you would think of in terms of a typical wellness or even organizational strategy. But we need to start with a vision, then analyze where we are relative to that vision. Then we can prioritize and optimize to achieve that vision. And when I think about culture, a lot of people think about culture in terms of health, cultural health. How do we get the best trust, the best leadership, so that we could create a non-toxic work environment? How do we optimize team capability, et cetera? What a lot of organizations don't think about is how do we create an aligned organization, aligned culture? So these are all on scale of bad to good. Nobody's going to say low trust is a good thing. Poor leadership is a good thing. So you want to optimize all these. These on the left, though, are all things that are on scale of good to good. So if you think about customer orientation, are you transactional or are you customer intimate? If you don't understand this and don't hire accordingly, you could create a very toxic and unhealthy organization. So if you're, let's say, a McDonald's and you're hiring people to work behind the counter, and they need to get through as many people through a busy lunch hour as possible, but you hire somebody that's customer intimate and they're striking up a 5-minute conversation with everyone that comes through, how do you think they're going to do professionally in that role? How is that store going to do if they hire a bunch of people to work behind those registers and they're really focused on that intimate relationship? They're not going to do well. That's going to create stress, anxiety. They're not going to perform as well. And that's going to ultimately have a deterioration in their health and the ultimate culture of the organization. So you need to be thinking about what are those dimensions of our aligned culture. So what is the potential impact of this? So that study that I told you that I did based on that maturity model, one of the things that we did was we had these independent outcome variables, and we actuarially adjust them for industry, demographics, et cetera. And we looked at, well, how did that top quartile on our Healthy Enterprise Index, which is really a compilation of all of the elements on our maturity model. And we said, what is the impact? So we had almost 300 employers participate in this. And so what we found is the top quartile had significantly better health of their people with almost 10% lower healthcare costs, 22% lower rate of increase in their healthcare costs. Their employee withdrawal behaviors were significantly better, with 33% lower turnover, 37% lower extended absence. And then they had a safer workplace with 17% lower workers' comp costs. Now, how many people would say that if you're in the top quartile here, that would create a competitive advantage against a competitor that may not be? Not many, huh? Okay, I would think that if you could reduce those costs, that would create a competitive, that's one example of a competitive advantage. But it's also the people that you're getting into these positions that's going to make a big difference as well. So how do you get to this change? The things that I found really make a difference is you've got to have a vision, an inspiring vision that everyone coalesces around, something with purpose. You got to have everyone bring consensus. Everyone has to have consensus around this vision, and everyone needs to be pulling in the same direction. You got to bring the right skills to the table. Everyone has to have an incentive, not necessarily monetary incentive, but everyone needs to have an incentive to support that vision and drive towards that vision. You got to make sure you're able to invest the right resources. And it isn't necessarily you've got to invest new resources. All of you are investing ungodly amounts of money in your people already. I've never done it where I'd said, actually, once or twice I have done it where they were only putting in new investments. And those were the least successful initiatives that I had. Every time that I've done this, it's more a reallocation of assets, and you get the best results that way. And then you got to have an action plan that you work continuously. When you get all those, it works. If you don't, you're going to wind up with confusion, sabotage, anxiety, resistance, frustration, or you're going to feel like you're on a treadmill. And you don't want that because you're not going to drive results that way. So real quick, I'm going to just do a quick a couple of examples where we've applied this. So this was a 12,000 employee health system. They had 10 different hospitals they've acquired. They already had them all on the same health plan. They all had different contribution structures, some wildly different. We want to get them all onto the same contribution structure and advance the wellness initiative they have. They're already getting over 50% participation in their wellness initiatives, and they were able to demonstrate that they were getting significant impact of that. So what they came to us, they said, we want you to help us drive this to another level, get us all consolidated on this, comply with the ACA requirements around wellness and incentives and other ACA requirements to avoid any penalties. And then what we were able to do then through the process, we applied a lot of behavioral economics through the design and communication of this, but we were able to get them to 98% participation in their biometric screenings, which included all 5 metabolic syndrome measures as well as cotinine testing. And we were able to document that we got them to 75% risk-free of all 6 measures. And their costs actually, we designed it to be cost neutral. They actually wound up reducing their plan cost by $2.5 million, and the employees actually reduced theirs by $2 million when you think about both contributions and the out-of-pocket costs, which was huge for them. And this thing factored in any incentives that they baked into it. This next one is a university. They were a top-ranked university system. And this is applying a different benefit, which is their time off program. And we took them from a sick and disability plan to a PTO plan. And we were able to get them, and we looked at 3 years before implementation to the 3 years after. But we got them to a 52% reduction in unscheduled absence, 72% reduction in extended absence, so 5 days or longer. The 95% reduction in employee relations issues dealing with absence and tardiness. And then they had turnover of their best employees went down by 29%, of their worst employees went up 36%. And that had a huge impact on their culture. And they said that was the biggest cultural difference that they had made. There's one more that I'm going to skip so we give Ray a chance to talk as well.
First, I want to say how grateful I am to be able to share the stage with Fayez and with Steve. And I want to thank Chris for giving me this opportunity to share some of our thoughts and research as well. The remarkable point that to begin with, to share with you, is that Until recently, I didn't really know Steve and the work that he was doing, and Chris actually brought the two of us together. And yet, through independent research, we've been able to do some remarkably similar things. And in science, one of the ways that you can validate that you're on the right track is with independent reducibility. And so what I'm going to share with you is a remarkably similar journey with remarkably similar results. And so about 10 years ago, I started this company called HealthNEXT under the thesis that there are some companies who have had sustainably flat healthcare costs for extended periods. I know that sounds incredulous, but I will tell you that when I was the chief medical officer of what was until recently called IBM Watson Health, when I was the chief medical officer, it was called Truven. Today it's called Meritive, through a series of transactions. We were managing the data for about half of the Fortune 500 companies. And when you dive deep into that data, initially we were able to find 8 companies that were generating that orange line in the left upper corner. And adjusting for inflation, their healthcare costs were going down. So something special was going on in these companies. And like Steve said, as opposed to trying to compare companies to the average, which incredibly some even data analysis companies call a benchmark. That's not a benchmark. What we decided to do was to study these benchmark organizations and develop a methodology to let other companies have the same success. And this is really no different than the great business book called Good to Great. How many people know this business book? Okay. What's that business book say? It says we're going to study good companies that became great and develop a methodology for all good companies to become great. That's really what Jim Collins' organization was all about. So 10 years ago, HealthNEXT started on this journey to study all of the literature, and there are some seminal things that have been written. Thankfully, some of these benchmark companies have taken the time to produce research, like Johnson & Johnson and Navistar. And then we were on our way to first doing tertiary research, meaning study the research of others, and then secondary research, doing some study with others, and then doing our own primary research. And some of this does culminate, as Fayez mentioned in my textbook, Population Health, Creating Cultures of Wellness, which I can shamelessly plug because all of my royalties go to the School of Population Health at Thomas Jefferson University, where I've taught. And so I don't get even a dime if you buy one of these books. But it is now actually used by 165 medical schools and graduate schools across the country. So maybe the greatest part of all of this work is we are creating a next generation of experts that understand much more deeply what we're trying to convey to all of you today. In the end, our research showed that companies who build sustainable cultures of health, safety, and well-being have 2 things, at least 2 things. And again, this is going to sound like a shameless promotion. But one of the things that they had, and this was emphasized in our earlier sessions, one of the things they had was a physician executive or health executive expert guiding the way. Someone who had maybe as much as a decade of understanding in the healthcare system in a leadership role. Beyond just having somebody who is an expert in benefits or human resources. Imagine the possibility of actually marrying up all of the terrific work and skills and science that you have in human resources with people who are expert in the field of population health, in the field of building cultures of health, safety, and well-being. In addition, all of these organizations who had achieved a culture of health and well-being had a multi-year strategic plan. If you walk into an employer and you say, well, how do you handle your healthcare issues? And they say, each year we sit down before open enrollment and decide what we're going to do for the coming year as far as a benefit design program, but they don't know what they're going to add 2 or 3 or 4 or 5 years from now. That's an organization that needs some work. And so my company, HealthNEXT, developed a methodology that generates a strategic plan and then has a panel of world-class physician executives for you to access on a fractional basis. Because it's very expensive to have somebody full-time like me or Fayez on your staff. But it's certainly possible, even for small companies, to take advantage of the fractional use of this kind of expertise. So what I often talk about is this notion that if you want to take your family to Africa, for example, you're not just going to go on Google and book a hotel. You're going to identify some kind of a guide and establish a roadmap and an itinerary for your travel. And that's, in essence, what HealthNEXT does. There's certain tenets to our methodology, and I'm going to try to share them very briefly with you because I want to give you some gift of this process that you may be able to transfer to others, and we can build a movement that focuses not just on unit healthcare costs, but in, as Dr. Fayez said at the opening remarks, reducing the need for healthcare. And as Steve has already said, giving an organization the opportunity to enjoy so many other benefits from a healthy, well, and safe workforce. For those of you, when I worked for Jack Welch, he used to hand us a book and say, read this tonight and create one slide to summarize it because we're all very busy. So for those of you that don't want to read my textbook, this is the one slide. So what is population health? Population health is at least the equal focus on keeping well people well, which the American healthcare system does a very poor job of, as well as reducing risks that for people who have risks so they don't move further down this line, making sure that every person who has an acute illness has rapid access to care, especially with advanced primary care, seeing to it that people who have chronic conditions do not succumb to the complications of their disease, and making sure that people who have catastrophic illness get the best care that this healthcare system can provide. Centers of excellence. Now, when you start to look at all the things that can touch a culture of health, safety, and well-being inside of an organization, there is a lot of what we call factors. And unless you have an organizing platform, like the one that we developed at HealthNEXT, which is a digital platform, you can't really put all these together in an organized fashion. You can't identify where your strengths are and your opportunities. You can't, once you identify your opportunities for improvement, sequence them in the right order, the same way that our artificial intelligence in our platform makes it possible. And so when it all comes down in our model, which is really very similar to Steve's, and by the way, I'm not competing against Steve because I think actually Steve's model is even at a higher level of the organization. My model will help you with sustainably flattening your healthcare costs forever. My model will nurture your workforce from a health, safety, and well-being standpoint. His model may even take it to another level because he's working on eliminating other, I'll say, issues around perhaps morality, like Fayez talked about, ethical standards, integrity, eliminating any toxicity in the environment. I mean, so I think our programs actually marry up pretty well. But anyway, this isn't that different than what he presented to you. When we look at all the factors that contribute to a culture of health and well-being, it really comes down to what we call these 10 pillars. And as everybody has mentioned, it starts with leadership support and management alignment. Recently, there was a white paper written by Deloitte. The title of the paper was, Dear CEO, you can no longer delegate all issues around health, safety, and well-being to your human resources and environmental health and safety teams. You got to be actively involved. And by the way, in the research that we have done at HealthNEXT, the C-suite is remarkably ignorant of the actual illness burden of their workforce. They have no idea what percentage of their workforce is overweight or obese. They have no idea what percentage of their workforce is overly consuming alcohol. They have no idea what percentage of their workforce is basically sedentary. They have some idea of what percentage of their workforce are high-cost claimants, because that sometimes gets to their attention. They have some kind of an idea that something like 20% of their workforce may have a chronic condition, but they don't know what chronic conditions, and they don't know the relative prevalence of those things. We have to get them much more aware and involved, and then we work our way from there. But early on, as a process of our assessment, we generate a multi-year strategic plan for our clients, and then we work the plan with the guidance of a physician executive. When we do the assessment, we do the assessment with our clients in this automated platform, and we ask them where do they think they are from this paragraph descriptions, and then we ask them to document where they are by uploading a document. And as a consequence of that process, there's a calculation that takes place. Companies are scored out of 1,000 points, and we know from our research that 750 is benchmark. So you don't have to be great at everything, but you have to be great at about 3/4 of the 50 factors that we look at in this at least initial introductory platform model. And so this is the way we go about our process. It takes remarkably little time for any of you who are employers to get trained on our platform, normally 1 hour. It's remarkably easy to use. And then you work with your physician executive to complete the assessment. When there's an agreement on the assessment of the 50 factors, a button is pushed, and it's almost simultaneously that there's the generation of a 3-year strategic plan. And then you work the plan and you reassess. We normally recommend that you reassess every 6 to 12 months. And when that reassessment takes place, a new strategic plan gets generated for the next 2 or 3 years, and you keep iterating until you get to 750. I think Steve actually pointed out a lot of very good reasons to do this. I mean, I do understand, and don't forgive me for saying this perhaps, but this is the right thing to do.